Have you wondered why many people don't want to have vaginal delivery these days? One of the reasons is because they are afraid that the vagina is going to be caught in the birthing process. Another reason is that they are afraid of pain. Now, today we're going to be talking extensively about cutting of that wall to allow baby to come out of the perineal. What are the indications for episiotomy? One, if the vaginal wall is too tight, especially in first timer, it can be cut. But you need to also know that it is not all first timer that will need this type of cut. And most people who have delivered before might not need a repeat cut. They may have had it the first time, but by the time they are going through the process the second time, it may not be necessary because the place may have allowed may have expanded well. Number two, if there is a situation called fetal distress, maybe the heartbeat of the baby is not doing well during the process of labor, and your doctor needs to rapidly deliver that baby, and therefore anything that may want to impede the process will have to be taken out of the way, so it may be necessary. There is something we call instrumental vaginal delivery, when you are going to use vacuum like a tractor to pull out the baby, especially when the mother cannot push out the baby by herself, or we have to cut and put an instrument called forceps to hold the head of the baby or to hold any other part of the baby to pull out the baby through the birth canal. We can also need to have this type of cut called episiotomy. Or you are anticipating a difficult delivery, especially if you're going to have a big baby going beyond 3.8 and above, then you might be thinking that episiotomy will be in place. Alright, if you're also going to have breech delivery, there's a lot of maneuver that will be needed. Therefore, it may be part of the things you will need to conclude the process of your delivery. Then, if rapid delivery is needed, for example, a woman develops cord prolapse during the process of labor, and the doctor needs to rapidly deliver the baby so that the baby will not die in the process. So every obstacle is removed, and the doctor will ensure that this is done, and ultimately you will be fine and your baby will be fine.